program. Mahalo
Okay.
nui to you all.
Thanks, Kim. Aloha, everyone. Mahalo and welcome to a new episode of Ask-A-Kauka, presented by the Native Hawaiian and Pacific Islander Hawaii COVID-19 Response, Recovery, and Resilience Team. So I am Dr. Mary Oneha. I am CEO of Waimanalo Health Center and Chair of the Communications Committee of the NHPI 3R team. The NHPI 3R team was formed in early 2020 to examine and respond to the impact of COVID-19 on Native Hawaiian and Pacific Islander communities in Hawaii. Tonight, the topic is long COVID. Our partners tonight are Papa Ola Lokahi, Ahahui Auna-Kauka, the Association of Native Hawaiian Physicians, and the Queens Medical Center, with support from CDC and the Asian and Pacific Islander American Health Forum. Before we introduce the speakers, this Zoom webinar is being recorded and we're live streaming on several Facebook platforms. If you have questions, please use the Q&A panel at the bottom of your Zoom screen or in the comments on Facebook. So as the pandemic continues, there has been significant interest in learning more about long COVID and how to best support our families, our friends, and coworkers. We are honored to have two prominent physicians in Hawaii to help us understand long COVID. So first, Dr. Dominic Chow is a physician, scientist, and professor in the Department of Internal Medicine and Pediatrics at the John A. Burns School of Medicine. Following his interest in immunology, Dr. Chow is passionate about HIV/AIDS treatment and research. Dr. Chow helped to establish the post-COVID recovery and care clinic at Queen Emma Clinics. Dr. Jordan Kalenakai Lee, a graduate of the Kamehameha Schools and JAPSOM, is part of the team at the Queen's Pulmonary and Critical Care Group. He has seen the gravest COVID patients in the ICU, whom he has committed to treating with compassion. His unique reflections have been featured in a poignant 3-minute short video. So we will begin with Dr. Chow, followed by Dr. Lee, and then have some time for questions. So I will now turn it over to Dr. Chow. Thank you.
Dr. Noya, thank you all. Thank you for allowing us to give this presentation. Dr. Fritze Igno unfortunately couldn't make it for tonight's meeting, but she sends her regrets. Both Dr. Lee and myself are passionate about this topic, which really has affected us since as a consequence of SARS-CoV-2 infections. Not too long ago, about 3 years ago, we saw the devastation of this pandemic. You could see that in December of 2019, there was the first clusters of pneumonia happening in China, and then subsequently all through the world. And so you could see that globally this affected 521 million individuals. Here in the United States, about 90 million individuals, of which we surpassed 1 million deaths. Locally, here in Hawaii, there's about over a quarter million of individuals having had COVID infection, and then the number of deaths is over 1,500. And so I point this out primarily because it's a stark reminder to us all that the pandemic is still upon us, and that we still are seeing surges in the number of cases, and that if there's any way in terms of preventive health of getting people vaccinated and to reduce those numbers of deaths, perhaps we could actually even make some inroads into something that we call long COVID. And those are the consequences of acute infection. So you can see by this graph that the Omicron variant is causing serious surges, and we're on our 7th surge. And we could see that the Honolulu and Maui counties are at high risk. We are one of the red states at this current moment seeing a surge. And we kind of anticipate the surge to continue throughout June, and then leveling off at the end of the month, and then suddenly kind of being plateauing, and then maybe abating. But probably in the late fall, we will probably see another surge occur. Well, that's not the end to just acute, what we'll call acute infections. The next epidemic that we see as clinicians is this issue of post-acute sequelae of SARS-CoV-2 or PASC. Many of the listeners will be more familiar with long COVID or long haulers. And that is a consequence of acute infection of COVID leading to a whole variety of long-term consequences on health. About 10 to 40% of all COVID infections will develop what we call long COVID. And that's kind of astounding in that if we think of the population of Hawaii having been affected by COVID, 250,000 individuals having had SARS infection, you could see that about 20 to 40,000 individuals will have long COVID. The duration is unknown. It could be possibly permanent depending on how severe the cases are. And it's the high degree of disability. And I just point out the celebrities like Alyssa Milano, Lisa Dern, as far as what their symptoms are. For Alyssa Milano, you could see she has respiratory symptoms. Lisa Dern actually having increased worsening of migraines and swelling of feet and hand. And then for us locally, the late Kalani English actually had to step down from his post primarily because of long COVID symptoms. Overall, throughout the world, there seems to be over 100 million individuals worldwide having had or had long COVID. And to talk about the symptoms, the long COVID is again, subsequent to the acute infection. And these individuals we'll talk about will have fatigue, shortness of breath, anxiety, and concentration or cognitive issues. And so you can see by this cartoon, there are these circles that show the magnitude of how frequent these symptoms are. So for neurologic wise, you could see loss of taste and smell, headaches. Neurocognitively, what we call brain fog is not unusual. People with psychosocial issues or primarily depression, anxiety is very common. And then sore throats, what we have, nasal congestion, not uncommon. Cardiopulmonary, where we see the breadth of most of the patients in our clinic talk about chest pain and shortness of breath and fatigue and shortness of breath on exertion. You could see that there's dizziness and hair loss, skin rashes. And so it's just this constellation of these symptoms that occur post-infection, where the WHO has actually defined as a definition of long COVID. And so it just recently came out not too long ago. The term, the WHO definition, is that it's basically individuals with confirmed SARS-CoV-2 infection, usually 3 months from the onset of these symptoms that last for 2 months or more, that cannot be explained by alternative diagnoses. Common symptoms are fatigue, the shortness of breath, cognitive dysfunction, and really it impacts everyday function. The CDC definition for what we have in the United States, very similar to the WHO. The only difference is that we have a shortened period of time. The WHO one is 3 months. For the CDC in the US, it's 4 weeks post-acute SARS-CoV infection, and then lasting as mentioned above. And so these symptoms are quite debilitating for most of our patients. And so I just point this slide out because it does affect people of color. Our patients who are Native Hawaiian and Pacific Islanders, we see that the number of cases is much higher than the general population, again, against the African Americans, Asians, and whites in our state. You can see the number of hospitalization much higher than the rest of the population. The number of deaths by far is much higher. And it's also very reflective of the people who actually are seen in our post-COVID care clinic, the people who have long COVID. You can see that about over half of individuals who are Native Hawaiian, Pacific Islanders, and Filipino, they make up the bulk of the individuals we see in our clinic. And so it is a health disparity issue that I do want to bring up. I think it's also an issue of social determinants of health. By far, we've seen that the SARS-CoV infection has really deteriorated or eroded our safety nets in our society, where individuals who are having issues with having to go back to high risk exposure, not having job security, all those things play into this long COVID scenario that we see in our population. And so food security, not being able to get the adequate food intake and the necessary whole foods that we want people to have, housing, access to healthcare, social isolation, all of these things play into this ethnic disparity that we see in our long COVID patients. And so I think, with these symptoms, I think I'm going to turn it to Jordan, as he has a lot of experience. He's seen a lot in our pulmonary and cardiovascular center at Queens, and he could kind of talk to you about what are maybe the symptoms and what he's been seeing in the hospital itself. And so a shout out to Jordan. He was one of our students. We're very proud of him as he's really flourished and done very well since leaving medical school.
Thanks, Dr. Chow. Before we go into a little bit more about the presentation of COVID acutely, and then we have post-COVID. Dr. Neha, do you want to show the video now or maybe a little bit later, and then I can go off of like some of the things we see kind of on the front lines and what we're seeing nowadays also in the clinic as well. So we'll just show you guys a brief clip of like what's it been like to be there. So Thank you.
Thank you.
I'm Dr. Jordan Lee, and I'm a pulmonary and critical care doctor working in the ICU at Queens Medical Center in Honolulu, Hawaii. Right now, our ICU is at capacity with COVID-19 patients. I want everyone to know the suffering is real. And COVID-19 is like nothing else I have ever seen before personally, not in just the way that it presents itself to our patients, but in many other aspects. As a native Hawaiian, I became a doctor to better the conditions of our people, and right now, this virus is ravaging our Pacific Islander communities. Unlike other viruses and other conditions, most people stay in the hospital for an average of 3 to 5 days. But what we're seeing with the coronavirus is that they stay longer, anywhere from about 10 to 12, even 14 days. Some of our sickest patients have been in the hospital for about 2 months. We are concerned that if the COVID pandemic is out of control, that the hospital systems will not be able to take care of all these patients who are going to be coming in around the same time. Most of the patients, when they come to the ICU, are so sick that they require life support. So at that point, we put them on ventilators. We sedate them a lot of the times because their lungs are so stiff or non-compliant. They have to undergo paralyzation, so they're paralyzed. They're prone, which means we turn them on their bellies for a few hours a day, flip them back. It's a very traumatizing experience, and I would hate for anyone to have to go through that experience alone. One of the hardest experiences that I had was actually telling a family member, their loved ones, that this patient was going to die from COVID pneumonia. So the body had shut down. They were on maximal amount of life support, but they were still not doing well. And so normally we have face-to-face family conferences. We have the ability to be bedside with them and kind of walk them through our process and comfort them. All they can see is a window into our eyes because that's all they see when they go. So it's really hard.
It gives me some chicken skin. I haven't seen that video in a while. It's kind of amazing how far we've come, and yet it's only been, gosh, like 2 years ago since then. But my, what a change in the entire way we practice medicine and treat patients. So now as we're here tonight to kind of talk about what kind of symptoms and what kind of signs we see with post-COVID or long COVID. These are some of the things we want to talk about on the panel tonight. So thanks again, Dr. Chow, for kind of giving the introduction to this. And yeah, I just want to kind of elaborate on some of the things that I've been seeing in the ICU. So thankfully, with Hawaii being one of the best places and best states to administer vaccinations, our vaccination rates are really, really good. That's prevented a lot more on preventable deaths in the ICU in the state. So what we saw, hopefully, after the first couple waves, and particularly with Delta, it was a very severe strain. These further waves afterwards with Omicron, they're very contagious, but thankfully their symptoms are not as deadly. That's not to say that the long COVID symptoms will not kind of stay with patients for a long time. And that's kind of what we're talking about tonight. So I don't have a lot of slides. I actually don't have any slides. I just want to kind of talk story and kuka with everyone. So there are some questions that we want to talk about. So like what What do I wish patients knew about long COVID? So I think what I wanted to say is that we actually don't know a lot about long COVID. We are starting to learn the process now. There's a lot of studies going on, and Dr. Chow's part of some studies as well. Some of my colleagues are part of these other studies that we're learning a lot about how this disease is evolving, how we evolve with the disease as well. So there's still a lot to be determined about going forward. As Dr. Chow mentioned, some of the presentation of long COVID can be very nondescript, it can be very non-specific. A lot of things that we do see commonly is shortness of breath and fatigue, some mild cognitive impairment. And surprisingly, yeah, we do see a lot of sleep disturbance as well. So a lot of people having trouble sleeping, a lot of PTSD, post-traumatic stress disorder. So that's really come to play as well. Again, the onset can be variable, depends. It could be days after you get COVID, it could be weeks, could be months, and duration. That could also be very variable as well. So what we kind of encapsulate as long COVID is still kind of a broad term about all these symptoms. So we're still learning a lot about what's going on with this disease process. So is there anything else, Dr. Chow, you want to talk about on your slide before I switch back? And no?
No, I think overall, I think the focuses of disease oftentimes is typically, again, the pulmonary symptoms, as you mentioned, people having exertional issues, having shortness of breath, a lot of postnasal drip or cough that often disturbs their sleep, as you mentioned. Chest pain, and also the brain fog and depression and the anxiety, talking about the isolation that people often feels. Those are I think most of the clusters of what we see in our patients. People do have some musculoskeletal issues, but that tends to be much minor compared to those top 4 things that that we just mentioned.
Yeah. So on the flip side, as we're dealing with a lot of acute illness and acute lung injury, ARDS or acute respiratory distress syndrome, a year or 2 ago when we were unvaccinated, this was a brand new virus. Now we're kind of dealing with the post-COVID realm, post-vaccination era. So yeah, a lot of the prominent features that we see with long COVID include, as you mentioned, shortness of breath, dyspnea, chronic cough I see often. So as Dr. Neho was mentioning, and thank you for the introduction, I also do pulmonary medicine as well. So I see a lot of patients in our clinic here in town and at Punch Bowl, but I also see a lot of patients in Kona as well. I just got back there from yesterday. So I see a lot of patients who now are presenting with post-COVID or long COVID, chest pain, shortness of breath, lung scarring. So those are some of the things that I look out for when they come to my clinic in terms of what to evaluate for. So we always kind of start off with our standard tests, our chest x-ray, to kind of look for any kind of obvious infiltrates or scarring. If there's some inkling that there might be some, we might get a high resolution CT or CAT scan. Pulmonary function tests are also done in our clinic as well. These two have been a little bit delayed with having to have the need for COVID testing prior to pulmonary function tests, whereas before we would be doing basic spirometry in the office for every single patient that walked through the door. Now we have to wait months for a standard pulmonary function test. So that's kind of delayed the objective data that we have for long COVID. Other things that I would say patients should look out for is that we already know that COVID has affected our blood thinning and blood clotting capacity. So we do see a higher incidence of patients who have thromboembolic disease, venous thromboembolic disease. So they're forming clots, or they may throw little clots into their lungs, pulmonary emboli. So we keep an eye out for that as well. What I've seen kind of recently in the most recent wave, patients who get reinfected with COVID or have complications of COVID, so they get a secondary bacterial infection or a secondary bacterial pneumonia, they are much worse off than if they did not have COVID. And then we see when they do get admitted that they still have evidence of kind of a ramping up of their inflammatory system. So their white cells are elevated, their inflammatory markers are elevated, like C-reactive protein, and we're starting to do treatments that are, one, supportive, and two, we're still kind of evolving in terms of what we can offer patients. But as of right now, all we really have to rely on is steroids, and even then, steroids can kind of calm the immune system down, but they also have a lot of side effects as well. And the data is still out there as far as what dose is appropriate for long COVID. Should we be using it? Should we be using high dose, low dose? How long? So these are things that we're still up for debate and still studying right now. So there's a lot of kind of new information coming from everywhere and kind of yet to be determined. And as is with most medicine, it evolves. So yeah.
So we have a couple of questions coming in for you. So I'll just ask you the first question that came in. Does the chances of long COVID increase or symptoms worsen if you get COVID multiple times?
Yeah, that's a great question. So there was just a study that came out yesterday from the Veterans Affairs. They did a study about, I think, 160 or maybe 200,000 patients where they looked at reinfection rates for those who got COVID a second time. And yes, there is an increased risk for all-cause mortality, sorry. All-cause mortality, increased risk of hospitalization, and increased risk of pulmonary symptoms. And this is for patients who obviously worse if they were not vaccinated and got infected twice or 3 times, etc. But it also affects those who have been vaccinated 1, 2, 3, 4 times. So yes, as patients get more infections or exposures, and every time the body ramps up to kind of fight it, yes, there's increase for all of these things as well. So I always harp on my patients, especially those I see in the clinic with like COPD and asthma who have compromised lungs, to please get vaccinated so that they can prevent getting COVID again, or prevent getting COVID in the first place. Prevention is the best key that we have here. So I keep harping my patients to please get vaccinated when they can. So
if I could just stress on that point, I think oftentimes viewers will think that the vaccinations actually will reduce overall COVID infections. It can, but overall our goal with the vaccinations, just to remind people that the vaccinations is to really reduce hospitalizations, not necessarily get COVID. So oftentimes, some of my patients who are sometimes hesitant to get the COVID vaccination, they'll say, hey, people are still catching COVID despite being vaccinated. But I always reassure them that even though you get vaccinated, it's not, again, to reduce COVID infections per se, but to, really prevent the hospitalizations that occur. And then I think Dr. Lee could also mention or talk about what are the incidences of long COVID for people hospitalized and non-hospitalized, because I think the people who are hospitalized are at much higher risk. And again, if you fall into the group of getting hospitalized, your overall risk really goes up. And so maybe he could kind of elaborate and talk about what he sees in the hospital for that.
Yeah. So yeah, those who have already unfortunately come across or been admitted to the ICU or even hospitalized, they are already at risk for more severe COVID symptoms, more advanced risk of long COVID. Those also who have higher risk of long COVID includes those patients who have multiple comorbidities. And again, I think Dr. Chow raised a very important point about the intertwining of socioeconomic factors and access to healthcare. And so we have a lot of patients who are underserved or underprivileged or underinsured, not getting a lot of their care upfront or prevention. And we're seeing a lot of the sequelae of that right now. So people always ask, oh my God, is the hospital like crawling with like COVID right now? Just with the Omicron surge going on, like much higher. Like, no, it's actually not. as high as we expected, but we're seeing a lot of sequelae of those who have delayed their care, those who have the consequences of long COVID coming in afterwards, like can't breathe or they have lung scarring going on. So we see a lot of that going on now, but not so much the acute dying directly from COVID, as Dr. Chow mentioned, because a lot of people have been vaccinated, thankfully, but we can't save everyone, you know. So there's definitely high risk with those who have been sick and in the ICU, those who have been deconditioned from that, comorbidities, those who have been unvaccinated. And I think I wrote a note for one more. Yeah, I think that's it. Yeah.
Okay. So we have quite a few questions coming in, but someone wanted to see if they could get the link for the VA study that was mentioned.
Let me see if I can put in a chat right now.
Yeah, that would be great. Thank you. Another question that came in, is there a time frame when you've had COVID that you cannot become reinfected?
So that one's a little complicated. I think people often are asking that question because if they catch COVID, maybe they don't need to be vaccinated. And we do know that natural infection does offer you some protection, but not beyond 1 month. So we know that by 3 months post-COVID infection, or that most people are probably not protected from reinfection. And so courses of vaccinations are much longer, but also wanes in time. And so getting a booster will be important to, again, reduce your risk of hospitalizations. And there have been several studies that show that a consequence to actually catching COVID and getting long COVID, that by vaccinating, you actually can reduce your overall long-term of long COVID. So we do know that from several studies that it is imperative that if you haven't been vaccinated, you have long COVID, to get vaccinated, because there is a thought that perhaps people still harbor the SARS-CoV virus within the nasopharyngeal area. And then by vaccinating, they actually can finally eradicate and remove all, viruses out of their system.
Yeah. So related to your response, Dr. Chow, there was a question that said, when will the second booster be available to the general public? So I think the second booster is available now to the general public. Well, to the general public, I think right now they've it's by age, right, that they have it, or those who are immunocompromised for that vaccine. I don't know if both of you have any response. When will it be open to others, if you have a sense of that?
So it is currently age and due to severity of comorbidities. So individuals who have immunocompromised states, people on transplant, people with HIV, those individuals should get the second booster, so 4 doses in total. There is a Omicron variant vaccine, B1, that is probably going to be available later this year. And so specifically, it isn't the current vaccine, which is for Alpha. It will be for specifically Omicron, which will probably be later this year. And that would be a vaccine that would help, hopefully, kind of plateau this current surge that we see.
Okay. So another question, and I think both of you might have answered this already. Does the severity of any COVID infection increase the possibility of developing long COVID?
Jordan,
Yep, I think Dr. Chow mentioned that before, but yeah, it's those who've had more severe cases of COVID, those who've landed in the hospital, whether it's being on the medical floor, just requiring more oxygen, those who required intensive care, like landing in our ICU with COVID, those patients are more likely to have evidence or courses of long COVID compared to those who have just caught it and just recovered at home. Yes, so those who have been sick with COVID, so sick that you end up in the hospital, are more likely to develop long COVID symptoms. Yes.
Okay.
And just to add, because Dr. Lee is one of our intensivists, if you land in the hospital, your chances of actually going to the ICU is still about 50%, right? And so after individuals are into the ICU, then there's again another chance of actually expiring from it. And so when people are intubated, there's a lot of issues because they require mechanical ventilation. That causes scarring in the lungs. That's also psychologically quite devastating. And so all of these things kind of play into the factor. That's why, as Dr. Lee was mentioning, it's very hard to discern what's causing some of these long COVID symptoms. They could be vague. In terms of, well, was it because they were hospitalized and they had all these, bad things that unfortunately had happened to them, multiple IV sticks and putting on a ventilator, getting transfusions and all these things that could cause a variety of issues. And then is it the hospitalization that caused this, or was it because of the infection causing inflammatory issues leading to long COVID? It's still unclear. I think the people who are hospitalized versus the people who come to the long COVID, without hospitalizations, are kind of a little bit distinctly different from one another.
Yeah.
And I think it's a good kind of point to bring up as well, as far as like perspective. I think when we first were dealing with the pandemic and people were just like, oh, whatever, it's just a virus, it's okay if like grandma or kupuna die, it's like one in 10 or 1 in 100, but the sad reality is, yes, they're dying, but those who haven't died, 9 out of 10 will have now long-term kind of long COVID symptoms that they'll have to deal with for the rest of their life, that they will have to see more doctors for, like increased burden on the healthcare system. So these are things that we're dealing with now, and there's probably no end in sight with regards to what we'll have to kind of take care of for the long run. But yeah, just a little bit of perspective. I remember just kind of bringing that up when the virus first kind of hit us 2 years ago.
Yeah. So another question related to both of your responses is, what kind of complications could lung scarring cause? What can patients expect?
Yeah, so I see a lot of that in our clinic now. So we have these conditions where you have post-COVID or long COVID scarring that can be seen radiographically on X-rays or CT, but also in your pulmonary function test. So you become restricted. So the lung scars down. The ability to gas exchange is also greatly diminished as well. And patients end up even on oxygen for long term. Some who don't have the need for long-term oxygen will just feel like they can't catch their breath. Like our lung capacity has, because the lungs have scarred down so much from that rapid inflammation and scarring, are now very kind of tightened down. And yeah, so they're left with chronic dyspnea, they're chronic, sometimes hypoxemia if it's that bad. So yeah, we see a lot of that. And we've been seeing more studies as the pulmonary function tests come in that they do have evidence of restriction.
Yeah. Dr. Chow, did you want to? Oh, go ahead, Dr.
I was going to mention that we talk about like lung scarring and fibrosis. There is like a disease process within pulmonary medicine called idiopathic pulmonary fibrosis, or where the body kind of attacks itself on its own. This is a little bit different. So it's yes, it is attacking it on its own, but like idiopathic pulmonary fibrosis is a chronic keeps happening. It's the body's just scarring itself all the time. Whereas post-COVID is this big insult to the lung, rapid onset of damage, inflammatory markers, cytokines, the storm, as we talked about, the cytokine storm. So you have this big ramping up of inflammation and then scarring afterwards. The reason why I bring this up is that there are some therapies for antifibrotic therapy in our kind of idiopathic process. And so we're kind of looking to see whether or not there is a role for antifibrotic therapy in the COVID process. There isn't a standard of care for that right now, but I think that's an interest that we're looking into. But they work a little bit different, but it's something that we're kind of thinking about just because there's so much scarring going on with moderate to severe COVID, with long COVID afterwards. So sorry.
No, that's great.
I'd just like to just add, what Dr. Lee just mentioned is really some things that we really are really keenly looking for. So many of the listeners may know about the cruise liner. In the individuals who all had symptoms, obviously they had scans of the lungs, and it showed majority of those individuals having scarring of the lungs. But what was quite interesting was that the people who had no symptoms, who had long COVID, who had COVID infection, they also scanned their lungs of these individuals, and 80% of those individuals did have evidence of some scarring. So individuals who didn't have any respiratory symptoms, they did have some type of findings on high resolution CT. And then we ourselves in our clinic, as we're doing some research studies, we found that in terms of pulmonary function tests, about 80% of all individuals who have fatigue and some shortness of breath, they also have problems with the pulmonary function test. And so even individuals who have mild symptoms or having findings on CT scans and also pulmonary function tests.
I wanted to ask both of you about, Dr. Chow, you presented about the social determinants of health and how it can impact or exacerbate long COVID. So for both of you, what types of supports are needed for those who are experiencing long COVID? And by supports, I mean, from families, from friends, from the community, even from employers. What type of supports would be needed for those experiencing long COVID?
I'll start off with just saying what I think, and then Dr. Lee could then mention about what the supportive services in terms of pulmonary rehab and trying to get people back to, I think that by far the most important aspect is to be supportive for family members to be supportive of their loved ones. One of the first things that often happen is people say, well, you're over the COVID infection, get with it. It's minor, it's something that you should just move on with. And what we're trying to tell family members who come along with their patients is that this is a real entity, and that they're not faking it. There is some biological reason why they're having fatigue and shortness of breath. And so as a family, being supportive of their loved ones, and then trying to get them to incrementally improve their health through rehab. We don't have the answers, as Dr. Lee was mentioning. There isn't a magic pill I could give people. There's nothing I could give IV-wise. It's really the long road of recovery from these viral infections. So like any chronic disease, we need to be patient with our loved ones and to have them do really physical therapy to get them back to a state of recovery. And that often may take months, may take years, but it is important in terms of supporting them. And here at Queens, we try to be supportive in giving physical therapy. We try to get them the right specialists in terms of things, but we also do a fair amount of education. Dr. Lee, do you have any, or what would you also add to the rehab that we also do?
Yeah, I agree. I wish there was like a magic pill or magic money or healthcare system we just like magically create. But yeah, there's no magic answer. And I think the long haul for this long COVID is that, yeah, you have to be very supportive of your family and realize that this is going to be a chronic condition, On the flip side of that, I think it's also important, again, to kind of hammer down to our audience and also to our public and our ohana is that prevention, again, is key. So those things that we talked about, reinfection, severe COVID, comorbidities, we see a lot of that in the islands, with obesity, diabetes, hypertension, like all these other chronic conditions that if you prevent those, then you're less likely to get reinfected or less likely to get long COVID symptoms. So getting vaccinated, trying to keep up with your health, your sugars, your blood pressure, trying to get rehab, trying to do exercise at home, all those things are very important. They may not seem like it in the long run, but they're just as equally important than just taking care of your high blood pressure. So this is going to become like another chronic condition that we have to get regular checks on. So making sure that patients and their families know how important it is to get regular checkups and getting seen by specialists such as myself if they're having more prominent pulmonary problems, to be supportive of those kind of efforts too. So.
And if I could just add a plug for community health centers. I mean, for community health centers, I think
Thank you.
but the focus is actually on the person, but not only the person, but also the community at large, right? And so community health centers have a big role. Medical centers can't. We're all, you know, we only look at a narrow portion of what the patient's going through. Community health centers provide a range of services that is beyond our scope, you know, making sure that people get access to food, financial support, social support, and then also the whole idea of actually being a community, right? Getting people involved. I mean, again, we would talk about social isolation, feeling depressed, anxious. Those are things that we can't fix with a pill and things of that nature. It's a community aspect that needs to be incorporated into the well-being of a patient.
Yeah,
So
great.
true.
Well said. Thank you. We have a couple more questions coming in. I know both of you talked about the organs that are affected by long COVID, but we have a question. Are other organs affected by long COVID as the kidneys and heart? So do you want to reiterate that?
Yeah,
I'll leave that for Dr. Chow.
So we know that research has shown that every organ basically almost so I'm an HIV provider, and before me, they will always talk about syphilis. And so these infections can affect any part of the body. And so people have heard about long COVID affecting hair, skin. My son is a dental student. He'll talk about, you know, loss of teeth because of COVID itself. And so again, but long COVID is a consequence, I think, of the initial infection that leads to a state of inflammation. And that in itself causes a whole host of issues that is exacerbated by other comorbidities. So people who have diabetes, as Dr. Lee was mentioning, you know, that'll be worse. Hypertension, that'll be worse. And so all these things as a constellation of overall health-wise is worsened because of the COVID infection. And so we got to break the cycle and then try to see if we could get people to be recovered.
Great. I have another question. Are there support groups for patients' families dealing with long COVID?
Dr. Chow.
Yeah, so there's overall, there's a long COVID national recovery. Here at Queens, we've been trying to actually see if we could actually get one started because again, our patients who are here locally, they have a special need and a special, you know, we want to actually be more focused in local needs. And so, yeah, the Queens is trying to establish one to, as patients are going through this, it's hard. I mean, people dealing with this by themselves it could be traumatic, and there doesn't seem to be any, you know, end in sight for those people. So being part of a larger network of individuals is important.
And also, like you said, a plug for our community health centers, our Native Hawaiian health centers, our community clinics. I mean, these are going to be excellent places to kind of form community building and family support for those out in the community. So, yeah.
Yeah. Can you talk a little bit about how people with long COVID or even their families can access your services?
So for the long COVID clinic at Queen Emma Clinics, they could, there's a long COVID website that people, usually it requires a clinician, their PCP, to be involved and to make the referral. We do this primarily because, again, it's not just one person. The whole community has to be involved. And the primary care physician is so integral to the recovery of our patients. And so we try to get all these individuals kind of aligned and connected.
Okay.
I'll provide the website later.
Okay.
I just put in the chat too. But yeah, as far as those who have severe lung issues, you can find us through the Queen's website as well, in terms of getting an appointment with our pulmonary clinic, either myself or one of our other many pulmonologists in the group. So.
Yeah, great. Do you know, I think earlier on before we started, you had mentioned that HPH may also have, so do you know of other facilities besides Queens that also have supports for long COVID?
Yeah, I was just mentioning to them that Dr. Bennett Louis, who's one of our former students here also at our medical school, is actually part of the or director of their HPH long COVID program. And so he kind of has kind of championed their long COVID kind of activities. I think if individuals are not able to access the activities within Queens or within HPH or even outside, that there are national resources that are available to be acquired. And so I could also leave some of that information so that people are able to get the information they need.
Okay. We have another question that came in. What are your thoughts about the research on yogic breathing to improve outcomes of long COVID breathing difficulties?
Yeah, I'm all for all traditional therapies. And so I think because it is not something that we have clear understanding, as Dr. Lee was mentioning, we don't know the mechanisms of what is driving long COVID. It could be multiple mechanisms. And so in terms of that deep breathing and meditation, we do know that the vagal nerve is injured from SARS-CoV infection. And so by aiding that type of recovery, one can actually get improved vagal tone and therefore have some recovery from, by far, the tachycardia that people often have. There's a syndrome that's called postural orthostatic tachycardia syndrome, or POTS. I think it's renamed post-COVID tachycardia syndrome now. And in those cases, the heart rate really races, people feel orthostatic, and they have evidence of what we call autonomic disturbance. So they feel as though they're always dizzy, they're always tachycardic, they don't feel well, there's vague symptoms. And so in those cases, deep breathing has been found to actually be helpful in those cases. And so again, I think all these types of traditional therapies has been augmented to help the recovery of our patients.
Yeah, I'm all for doing exercises and healthy activities as well. So getting out there in the ocean, getting back where we can, get some vitamin D, fresh air, yogic breathing as well. So kind of increasing your lung capacity, your incentive spirometry, all those things are good. I don't know the exact research on that right now, but it's definitely something we still encourage our patients to do to stay active and stay healthy as well.
Okay, great. So we just have a few more minutes left. Are there any closing comments each of you want to make?
Jordan, you want to go first, and then
sure.
Because I want to give a plug to research.
yeah, that's fine. Again, thank you guys for joining us on this evening to talk about long COVID. I know it's an entity in itself that's still kind of evolving, and so the treatment, the diagnostic tests are also evolving with this entity as well. So again, stay aware of what's going on. So read the news and talk to your local physicians, talk to your specialists. If you do have questions, always ask. This is going to be a long haul game for everyone. So we have to support each other. Again, I wanted to relay the message that prevention is probably the best key that we have for treatment here in the long run. So again, get vaccinated, take care of yourself, and be well. So thank you guys for your time tonight.
Thank you, Dr. Lee. Dr. Chow?
And so I just wanted to, the University of Jabson as well as Queens, and also HPH, as we're all getting together because HPH at the Kapilani is doing studies on children, pediatric recovery. And so just leaving a plug for people who may be interested in helping us kind of learn more about long COVID. As Dr. Lee was mentioning, it's a very new entity. We don't know so much about it. We hope to learn a little bit more and really get to know what the incidence is. And so the Jefferson, Queens, HPH is open for this recover study. And this recover it basically means researching COVID for enhanced recovery. And so it's a 4-year study. It's recruiting individuals who have had COVID infections and people who never had COVID infections. And so participation is really open to everybody, because not only are we looking for people who have had COVID and have recovered completely well, or people who currently have long COVID, but we need a group of individuals also looking at controls, basically comparing what is really going on with our patients. And so this is a 4-year National Institute of Health study. We're going to recruit a fair number of individuals across the country. We're trying to understand long COVID, and we're seeking to learn more, especially how it impacts individuals such as Native Hawaiians and Pacific Islanders and Filipino, because it's a special group. What happens in the mainland is not necessarily what happens here locally. And we hope that that can actually help us kind of so that we could then learn what we know to help other individuals, especially with long COVID. And so I ask people if they're interested to call the number at JAPSON. You could email us at covid@hawaii.edu because we're, again, the study is trying to look at long COVID and how we could help people. And that might actually open, people ask always, so what can I do about it? Because this trial will open into other trials, open up for the public in terms of, newer experimental therapies, new investigational therapies in terms of long COVID.
Great, thank you. So I just want to wrap up and thank you, Dr. Lee. Thank you, Dr. Chow, for your time, for your presence, and for your invaluable information that you shared with us. I think it was excellent, the information that you provided. I certainly learned a lot tonight. I also want to thank our audience for participating in this webinar, and give a special mahalo to some of our sponsors as CDC, the Asian American and Pacific Islander Health Forum, Ahui Onakauka, the Queen's Health Systems, Papa Ola Lokahi for technical support, and again to Dr. Lee and Dr. Chow. Thank you all for attending and for your input. You can also find more programming and resources at nhpicovidhawaii.net. So thank you all so very much. Aloha. Have a good evening.